Hi guys, my name is Bemsel Olaniran. So I'm talking about the healthcare reforms in Minnesota and New York. So I'll be comparing Minnesota and also New York. Expanding to another state presents both opportunities and challenges for organizations that intend to do so. Apart from the usual new market, customer base, and cultural challenges, an organization, especially a healthcare one like Rasmussen healthcare system, is likely to be affected either positively or negatively with reform policies in the new state. This presentation gives an analysis of the similarities and differences between two healthcare reform policies in Minnesota and New York and recommends if it is a good idea for Rasmussen healthcare system to expand to the state of New York. Minnesota Care. This is a healthcare program in Minnesota which pays for the children and adults in the state and that do not possess healthcare insurance that is affordable. Minnesota Care purpose is making health insurance be affordable more to the people that have no or little coverage, especially adults and children. The healthcare reform policy aims at those that are known as unsecured for those that cannot afford insurance. The healthcare reform policies aims at setting a national standard of how the health insurance should be priced and covered that also places extra requirements on employers and individuals. Healthcare for All New York. This is a coalition of the entire state of New York, which is focused on winning healthcare that is quality, comprehensive, and affordable to everyone in New York. The purpose of Healthcare for All New York is to ensure that every individual in New York possesses a healthcare coverage which gives benefits that are comprehensive. HCFANY ensures that every individual in New York has selected a plan of public healthcare in New York. The other aim of this healthcare reform policy is ensuring that the costs associated with improving healthcare are controlled as much as possible. Healthcare should also be transferable easily under this reform policy and should allow for easy coverage continuously. The healthcare reform policy also intends to ensure that all the healthcare reform serves to eliminate ethnic, racial, and other discrepancies in the system of healthcare in New York. Lastly, the other purpose is to ensure that employers fairly contribute to the healthcare cost and the cost to have be reasonable and predictable. Similarities between Minnesota Care and AC Fannie. Both the two reforms are trying to address the challenge of acquiring insurance for the people that live under conditions which cannot allow them to afford healthcare appropriately. Medical decisions which are also made without considering all categories of people are another problem addressed by both. Both of two reform policies ensure that the insurance companies offer policies that are comparable at rates that are the same to everyone with a little variation. The complex system of buying insurance and paying providers of healthcare has been addressed by the two healthcare reform policies in the two states. For example, the two reform policies have made clear the difference between the deliveries of services of healthcare and how they should be paid off. Differences between Minnesota Care and AC Fannie. The main difference between the two is that while the Minnesota Care mainly addresses healthcare insurance coverage for children and adults, HCFANY is for all New Yorkers regardless of the age. Under HCFANY, it is not allowed that a patient is dropped from coverage. It is no longer possible to drop coverage to start with, and this is not the case of the Minnesota Care because there are some conditions that people have to meet to be covered by the reform policy, and therefore one can drop if they do not meet the requirements. The other difference is that HCFANY addresses Medicaid. HCFANY expands Medicaid to those that are working but have the poor income to a level of 133% of the level of federal poverty in New York. However, this does not appear on the agenda of Minnesota, and neither does the reform policy concern itself with Medicaid. For Rasmussen Healthcare, so the last slide is my recommendations. For Rasmussen Healthcare systems to expand to New York, it should be thoroughly prepared. It is clear that most of the healthcare reforms have got similar purposes in different states, but these two states have reform policies for ensuring every individual has got a healthcare insurance coverage, and this is one factor that will make the operation of the organizations easy. However, there are other policies like the New York State Healthcare Reform Act in New York that is a bit different from the healthcare reform policies in Minnesota. The healthcare reform policy has a purpose of ensuring the provider of healthcare take part in the funding of some initiatives of healthcare. Rasmussen Healthcare System has an opportunity of expanding to New York, but it has to ensure it employs additional staff who will be working to ensure that the organization remains up to date on the state's healthcare reform policies. Thank you. If you have any question, please do not hesitate to send me an email. Thank you. Have a good one. Bye.